Hi and welcome to this screencast. My name is Denis Otundo. Today we are going to look at interventional studies. Basically, there are two types of study designs, that is the interventional and the observational study. And the difference comes about because of the time course, where you have prospective, retrospective, and cross-sectional studies, and also the source of data, where you get the new data, routine data, patient notes, existing data, which of course you'll have to do secondary data analysis or meta-analysis. So interventional studies test the effect of a treatment or program of care, and the main purpose is usually to test for efficacy, but in early drug trials, the safety and dosage have to be established first before the study is done. And preliminary drug trials investigating safety and tolerance are often uncontrolled. And this is very reasonable because there's no need for you to control the experiment when you are basically testing for safety and tolerance. So what is a control group? A control group is defined by scientists as a group in an experiment or study that does not receive treatment by the researchers, and is then used as a benchmark to measure how the other subjects are doing. And it is highly desirable to have a control group in efficacy studies to be able to demonstrate superiority or inferiority. For example, it may be very useful to know that a new drug lowers blood pressure, but it is more important to know how it compares to medications already in common use, especially as existing drugs are likely to be cheaper. In historical controls, patients given a new treatment are compared with patients who have already been treated with an existing treatment regime, and normally who at the time of testing the new treatment have already been treated, assessed, and discharged. So the comparison of the treatment group and the control group is not concurrent, and this most of the time is problematic as other factors change over time, such as maybe, for example, the hospital staff or the staff who are involved in the research or study, and the patient mix. And the main challenge with the historical controls is that the interpretation is normally a challenge, and it is impossible to be sure that any differences observed between the new treatment group and the control group are solely due to the treatment received. Okay, I have also to mention that randomization is the best way to ensure that comparisons are concurrent and unbiased, and at times randomization is not possible. And for example, the use of adrenaline for cardiac arrest is generally accepted as effective, but it would be very difficult, if not impossible, to formally test this against a control treatment. So under natural experiments, the individuals receive different interventions concurrently but in a non-randomized manner, and we'll go through two examples. So the first example, if we take the effect of fluoridation of drinking water, which may involve a comparison of subjects in areas where the water is subject to natural, artificial, or no fluoridation at all. The subjects are not allocated to the different types of fluoridation, and this is determined by where they live. It cannot be controlled by the principal investigator or the researcher in this case. The second example is that the effect of treatment may be compared in patients who choose conservative surgery for breast cancer rather than the radical surgery, and in this also the patients are not randomized. And those two examples are examples of natural experiments. Of course, there are at times where interventional studies are unethical, and we will have examples to this in future screencasts. So last but not least, we look at the design and analysis for non-randomized studies and natural experiments. during the design and analysis, you are advised to collect as much data as possible on the subject's key characteristics. That way you'll have the maximum number of respondents and the maximum number of variables, which should be as exhaustive as possible. You should also use statistical analysis to adjust for these differences, and we'll see the different ways in which statistical analysis can be used to make these adjustments. And it's good also to note that even with statistical adjustments, there may still be differences between the groups that are unknown, and so the comparisons may still be biased, and we'll look at examples to this. Last but not least, interpretation of non-randomized trials is sometimes a challenge, and firm conclusions are hard to draw. In future, we'll be looking at details of the randomized control trials and how to choose the comparison group. We'll look at an issue called the usual care in choosing the comparison groups. We look at also the Declaration of Helsinki and the details to that. So thank you.